There we go. I'm going to talk to you about integrated health homes. And one of the things that an integrated health home is, it's a federal program implemented at the state level to take care of people who have mental health challenges, either serious mental illness or severe emotional disturbance. Severe emotional disturbance is applied to children. We're going to talk about children today because they're our most vulnerable population. This program started in June of 2013. It's a very interesting program. We're going to show you two graphs on top of each other. One is enrolled. Those are the people that are enrolled. Note how that changes. I want you to watch that line as time goes by. And the next thing is going to be a graphic of people coming in and out. Blue is people coming in, orange is people going out. So we're going to talk about how these large policies people put into play at the legislature and all over suddenly affect little tiny people who need help. So let's talk what happens. The very first one that you see is the IHH beginning. Lots of children come into the program. They have been waiting on average for 24 months to get services. Oh yeah, that's right. If you're a parent who has kids that need help, you're going to apply to get on the Children's Mental Health Waiver, and they're going to tell you, we'll call you in 24 months when a slot opens up that your child can take. So you've already waited 24 months. Now you're in the program and suddenly things start to happen. This little orange circle says, oh, we've decided we're not going to do outreach services anymore. So at first they started to go out and say, hey, we understand from the state your child has some mental health issues. We want to help you. Come into the integrated health home. All of a sudden the state said, we're not going to tell you who needs help anymore. And what happened? We started to see people drop out because they weren't getting picked up by the integrated health homes. Then we have something called the 90-day contact rule going into effect. It's a little rule inside the waiver that said if you aren't seen by somebody in the integrated health home every 90 days, you've got to get kicked out. So what happens? Kids start to leave again. So now parents who had kids in the program all of a sudden don't have kids getting these services, all because of policies and administrative rules that we decided had to be put in play. Thankfully, there's about a year or so where things are going great. Everybody's going, yes, this program is wonderful. Emergency room visits are going down. There's fewer hospitalizations. They're getting in to see the doctor because the IHH is connecting with a primary care provider. Awesome, that's cool. Then we see the Medicaid managed care organizations coming into play. They go to connect with these kids and try to reassess them. Their parents don't know how that works. All of the rules are changing, and what do you see? You see a big orange there where people are dropping out. You see enrollment going down, and you will see that by the end of 2017, that enrollment never went back up. Never went back up to the point at which the MCOs came in. What I want you to know, every policy affects an individual. There are kids that need care here who lost it. So let's be thinking about that all the time. I'll love to talk to you at my poster, and I will talk at you just like it.